Have you ever wondered why so many people with diabetes also struggle with high blood pressure? Is it just a coincidence? Or is there a hidden connection that puts millions of lives at risk? If you or a loved one lives with diabetes, understanding this link is not just helpful, it could save your life. Today, we'll explore the science behind why diabetes and hypertension often occur together, how one condition can make the other worse, and most importantly, what you can do to protect your health naturally. Grab a comfortable seat and a cup of your favorite drink, because in the next few minutes, we'll uncover what many doctors don't have time to explain during rushed appointments. Diabetes and high blood pressure, a dangerous duo. Let's start by defining the two conditions. Diabetes is a chronic disease where your body either doesn't make enough insulin or can't use it effectively. This leads to high blood sugar over time, which damages blood vessels and organs. High blood pressure, or hypertension, happens when the force of your blood against artery walls is consistently too high. Over time, this can lead to stroke, heart attack, kidney disease, and vision loss. Here's the kicker: about 2 out of 3 people with diabetes also have high blood pressure. This combination, diabetes plus hypertension, is so common that some doctors call it the deadly duo because together they dramatically raise the risk of heart disease and stroke. The science behind the connection. You might be wondering, why do these conditions occur together so often? There are a few important reasons. 2.1 Insulin resistance. Many people with type 2 diabetes have insulin resistance, where their cells don't respond properly to insulin. Insulin resistance triggers a cascade of problems. High blood sugar. Inflammation in the blood vessels. Retention of sodium and water by the kidneys. That extra sodium and fluid raises blood pressure. 2.2 Damage to blood vessels. Chronically high blood sugar weakens and stiffens blood vessel walls. When vessels lose their flexi. 2.3 Overweight and obesity. Many people with diabetes are overweight or obese. Extra body fat contributes to increased insulin resistance, higher levels of inflammation, more stress on the heart and blood vessels. 2.4 Kidney involvement. Diabetes damages the kidneys over time, reducing their ability to filter sodium. Excess sodium causes fluid retention, which raises blood pressure further. Bottom line, diabetes doesn't just coexist with high blood pressure, it actively fuels it. Why this combo is so dangerous? When diabetes and hypertension team up, they double or triple your risk of heart disease and stroke. Accelerate damage to kidneys, potentially causing kidney failure. Increase risk of vision problems and blindness. Harm nerves throughout the body. The American Heart Association estimates that adults with both conditions are 4 times more likely to develop heart disease compared to those without either condition. Recognizing the warning signs. High blood pressure is often called the silent killer because it rarely causes obvious symptoms until serious damage occurs. Still, here are clues to watch for. Persistent headaches, dizziness or lightheadedness, blurred vision, shortness of breath, chest pain. If you live with diabetes, regularly monitoring your blood pressure is essential even if you feel perfectly fine. How to lower blood pressure naturally if you have diabetes. The good news, there are proven steps to lower blood pressure without immediately resorting to more medications. 5.1 Adopt a heart-healthy diet. Focus on plenty of vegetables and fruits, whole grains, lean proteins like fish and legumes, healthy fats, olive oil, nuts, seeds. Consider the DASH diet, dietary approaches to stop hypertension, designed specifically to lower blood pressure. Studies show it's highly effective. 5.2 Reduce sodium intake. The American Diabetes Association recommends less than 2,300 milligrams of sodium per day, or even less if you have hypertension. Tip: avoid processed foods. Most hidden sodium comes from canned soups, frozen meals, sauces, and snacks. 5.3 Move more. Regular exercise helps both conditions. Aim for 150 minutes per week of moderate aerobic activity, 2 to 3 days of strength training. Walking, swimming, and yoga are excellent options. 5.4 Manage stress. Chronic stress elevates blood pressure. Techniques like deep breathing, mindfulness meditation, Tai Chi can help keep your pressure in check. 5.5 Limit alcohol and quit smoking. Both raise blood pressure and increase heart disease risk. If you smoke, quitting is one of the most powerful things you can do. 5.6 Lose extra weight. Even a 5 to 10% reduction in body weight can significantly lower blood pressure and improve insulin sensitivity. Medication considerations. Sometimes lifestyle changes aren't enough on their own. If your doctor prescribes blood pressure medication, it's critical to take it exactly as directed. Common medications include ACE inhibitors, ARBs, calcium channel blockers, diuretics. These help protect your kidneys and heart over the long term. Never stop medication without consulting your doctor, even if your readings improve. Supplements. Can they help? Some supplements have shown modest benefits. Magnesium may help lower blood pressure slightly. Omega-3 fatty acids, beneficial for heart health. CoQ10. Some studies suggest a mild blood pressure reduction. But remember, supplements are not a replacement for a healthy lifestyle or prescribed medication. How to monitor your progress. Invest in a reliable home blood pressure monitor. Keep a log and bring it to your doctor appointments. Target readings for people with diabetes, ideally below 130/80 mmHg. Personalized goals may differ. Always confirm with your healthcare provider. Common myths about diabetes and hypertension. Let's bust a few myths. Myth: if my blood sugar is controlled, my blood pressure will automatically be normal. Fact: while controlling blood sugar helps, many people need additional steps to manage blood pressure. Myth: I can tell when my blood pressure is high. Fact: hypertension often has no symptoms. Myth: natural remedies can replace all medications. Fact: lifestyle changes are powerful but never stop med. Conclusion. So, can diabetes cause high blood pressure? Absolutely, and the connection is deeper than most people realize. The good news is you have the power to take charge of both conditions. Through diet, exercise, stress management, and, when needed, medication, you can protect your heart, your kidneys, and your future. If you found this video helpful, please like, subscribe, and share it with anyone who could benefit from understanding this vital connection. Remember, you're not alone on this journey. Every small step you take matters. Stay informed, stay empowered, and take care of yourself because you deserve to thrive.